Hello, I'm Dr. Victoria Rowan. I founded Sloane Medical around 15 years ago. This is a private medical practice that's involved in day-to-day general medical care. It has also become a specialist menopause centre and we're involved in health screening. Hereditary health screening is one of the most thorough genetic screening programmes in the private sector, providing peace of mind for you and your family. I realised a lot of patients were starting to ask me about their personal risk when considering HRT. Women wanted to start HRT because of their symptoms, but they were very worried because their mother may have had breast cancer and their grandma may have had ovarian cancer. Although I can put that into an app and I can give them a background risk from that example of 12 to 14% lifetime risk, and adding in HRT would add a 0.2% risk on top. But that's just an estimate. So some people may have inherited all those genes from their parents or none of those genes. And now we're going to be able to offer genetic testing to give people a better idea of their personal risk. Our aim is to ensure that this new form of preventative care is being managed by experts in this field, which is why we're working with Dr. Angela George, one of the top genetic oncologists in the country.
I'm a specialist in oncogenetics, which is looking at the genetic information and looking at that in terms of people's cancer risk. I'm one of only 2 people currently practicing who are both medical oncologists, so treat people with cancer with systemic treatments such as chemotherapy, immunotherapy and targeted agents, but also have a particular specialty in the use of their genomic information, both inherited and non-inherited, to both assess their risk and their family's risk, but also to guide treatment options. We've talked quite a bit about menopause and the impact that finding or not finding an inherited gene alteration can have on women who are considering HRT treatment, but there are lots of potential implications for men as well. So many of the inherited genetic syndromes that we test for will have different risks that are relevant for males. So for example, most of the breast cancer genes can also have an increased risk of prostate cancer for men. And that prostate cancer can behave very differently to the prostate cancer we see in individuals without a gene alteration. So it gets treated in a different way, it starts at a younger age, and increasingly it is also being screened for routinely, unlike those with prostate cancer that is not due to an inherited gene alteration.
Only around 15% of cancers are genetic, 85% are environmental due to things people have come into contact with, such as cigarette smoking or alcohol. So while we are giving patients access to cutting-edge genetic testing, we also need to make sure that we're carrying out comprehensive screening at a very high level so that we catch any other conditions that are easily treatable, such as high blood pressure or high cholesterol.
I think it's really important to realise that when we undertake this testing, we're undertaking it as part of a package which is looking at a range of different health aspects for patients. In doing this all together, we're really trying to focus on the holistic health of people and making sure that we really are providing the gold standard in care all around.
The service Dr. George and I are providing brings together world-class genetic screening alongside comprehensive evidence-based medical screening, ensuring highest quality patient care.